Good afternoon, and thank you for joining us. Today is Tuesday, March 1st, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here. And Mayor Johnson, I'll hand things over to you to get us started today.
Great, Catherine. Thank you so much. Appreciate that. Good afternoon, everyone. We continue to listen to the science and look to our health experts to guide us through the pandemic. Our transmission numbers continue to decrease. I'll provide an update on those shortly. And the CDC last week relaxed its guidance on face coverings, recommending masking for areas of high transmission, of which Milwaukee is not. With this information, we're proceeding forward carefully and with informed decision-making here in the city. Today, the mask ordinance for the city of Milwaukee has expired, and the city's masking requirements for city facilities and employees is also no longer in place. City employees can wear face coverings at their own discretion, except for a few limitations. Those limitations include those with approved accommodations, those working in healthcare or high-risk settings, and when entering a private residence or business if requested or required by the customer. While in city facilities, members of the public who are unvaccinated or symptomatic are strongly encouraged to continue wearing face coverings. As I mentioned, I'd like to share our COVID-19 gating metrics for the week, which starting Wednesday will be updated by the health department to align with the CDC's new guidelines. Commissioner Johnson will share more on this a little bit. We've dropped from the substantial to moderate transmission category for COVID-19 cases per 100,000, down to 45.2 cases per 100,000. And our percent positivity has dropped from the moderate to the low transmission category, down to 3%. We have not been in the moderate and low transmission categories since July 15th of last year. 63.3% of city of Milwaukee adults, those are individuals who are 16 years of age or older, have been fully vaccinated. 68.8% of adults have received at least one dose, and 45.4% are fully vaccinated with a booster. The health department finishes up its second round of school-based clinics in partnership with Milwaukee Public Schools on Friday. This effort has been a great way to get vaccine into the community, into the arms of students as well as staff. 887 vaccines have been administered to date, and we've just got 2 clinics left. We want to continue to see our vaccine rates in children increase beyond just these clinics, though. Here's a brief summary of all the mobile vaccine clinics for this week. So today, Tuesday, March 1st, from 10 a.m. until 1 p.m. at Marquette University Alumni Memorial Union, 1 to 4 at Hopkins Lloyd Community School. And then on Friday, March 4th, from 2 o'clock until 5 o'clock at Starms Discovery School. The schedule of mobile clinics is always available online at milwaukee.gov/COVIDvax. Finally, I want to take a moment to recognize our Commissioner of Health, Kirsten Johnson, on her 1-year anniversary with the city. She's done an outstanding job of leading the Milwaukee Health Department during this challenging time, offering information to the public through these briefings and other public appearances, and prioritizing the health and safety of our residents. So Commissioner Johnson, thank you so much for all that you do for the city and for the health department and for our residents. Now I'll turn it over to Milwaukee County Executive David Crowley.
Well, thank you so much, Mayor Johnson. And first and foremost, I want to say congratulations to Commissioner Johnson as well as happy Women's History Month to everyone out there. And thank you to all the women that have contributed to our history and to all the great things that we do. Good afternoon again, everyone. So today I want to start off by providing 2 updates related to the county's COVID-19 policies. So in response to the recent promising downward trend in COVID-19 activity, not only throughout the state, but as well as throughout the Milwaukee County, we have updated our facilities capacity limits administrative order. And so as of Thursday, February 24th, most county facilities may now operate at 75% of the stated capacity. And this is up from 50%, which facilities were previously operating under. And so based on the CDC's new classification metrics of low, medium, and high disease burden, Milwaukee County's community level is currently classified as a medium level of disease burden. And as you all heard from Mayor Johnson talk about the city's mask order expiration, Milwaukee County is also updating our own masking guidelines as well. And so as of tomorrow, Wednesday, March 2nd, masks will only be required in our high-risk essential service facilities. And this includes our Milwaukee County Courthouse. This includes the House of Corrections, the County Jail Facility, Behavioral Health Services Hospital, the Youth Detention Center, as well as the Marshall Collins Human Service Center. And in these high-risk environments, masks are still required for employees as well as the public. But county employees will no longer be required to wear a mask when moving about in non-public spaces or when not engaging directly with the public. But additional guidance will be provided specifically for the Mitchell International Airport, as well as the Milwaukee County buses, which adheres to the federal guidelines. And as many of you know, since the start of the COVID-19 pandemic, we as a county, we've taken a measured stepwise approach to our COVID-19 policies, and we're going to continue to monitor COVID-19 levels in the community and adjust the guidance as needed. So please keep in mind that we all live with different risk levels. And as we continue to hear from other leaders on this call, I want to ask everyone to be respectful of each individual's masking choice, okay? So we do not know what others are living with, and we don't know who in their lives they need to protect. And when we think about masking, it is still a helpful mitigation tool, and people should continue to wear a mask based on their individual risk level. And so when we think about the recent downward trend in COVID-19 cases, it is promising. But when you think about the continued progress, it's going to require us collectively to be vigilant, as well to continue to put an emphasis on vaccinations as well as booster shots. But I'm going to pivot a little bit because I want to recap last week, which was when I delivered the State of the County address and really spoke on the hard work county employees all over have been doing to really meet the needs of all of our residents. And thanks to them and their efforts, our commitment to a clear vision and a strong strategic plan, the state of Milwaukee County is strong. And so we spent the last 2 years literally implementing a strategic plan to really address the structural factors that allow racial health disparities to exist in our community. And so we're going to continue to work on turning these words into action. And we're going to do that by using the data to really help guide us in making the strategic decisions that improve the health of the people throughout Milwaukee County. And we also made a few announcements last week that I'd like to reiterate here, which is one, starting on March 10th, Dr. Kwaku Romel Smith will be joining myself for community conversations, which is going to be at the Wisconsin Black Historical Society Museum, to really address the needs of our community, particularly for folks in some of our most vulnerable neighborhoods. And so we'll have more information on how folks in the community can participate soon. But also beginning April 2nd, we're going to start the Healthy County Initiative in order to promote healthy lifestyles and equitable access to our parks, our trails, and all of our outdoor spaces. And so the county is also working on an initiative called the Year of the Youth. And this is to help us engage more intentionally with our young people throughout the community and really provide activities and opportunities for them to really get involved in. And so I would say that the future looks bright, and I'm energized by all of these great initiatives. And if these opportunities excite you, we could really use your help. And so I want to take this opportunity to say that we are hiring. Milwaukee County is an organization, we are hiring, and you can visit the Human Resources page on Milwaukee County's website for current job openings. And that website is jobs.milwaukeecounty.org. And we have a lot of opportunities to bring in change makers who wants to see that change and wants to be a part of that change in the community and really help this county move forward. And so if you missed last week's speech, you can watch it at any time on Milwaukee County Executive's YouTube page. So thank you again for this opportunity this afternoon, and thank you for joining us. And with that, I'd like to hand it over to Dr. Weston. Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. As an aside, I think it's worth taking note of the ongoing war in Ukraine. As we talk here each week about the impact of the pandemic on health and wellness in our community, we're now reminded daily by the news and images of this invasion of the impact that it has and will continue to have for many years to come on the health and wellness of so many in Ukraine, as well as around the world. The ability of the Ukrainian army and the broader Ukrainian people to stand up and fight and hold off a military many times their size is remarkable. So we'll hope for their continued support and success. On to our numbers here in Milwaukee County, we're seeing an average of 67 new cases per day and about 1 death per day. Our numbers are getting much better in the county across the board: cases, positivity, hospitalizations, and death. And this is good news. Still, we need to remember that we just settled from a tidal wave of cases. We should be cautious before assuming that another storm will not come. So we will see and be affected by other variants in the future. But in the meantime, we can be nimble in our mitigation strategies and respond to the disease burden in the community. Last week, the CDC released new guidelines on COVID-19 community levels. These levels consider both rates of cases as well as health system burden. Health system burden is measured by new hospital admissions and hospital occupancy to categorize counties throughout the country into 3 categories: low, medium, and high, or green, yellow, and orange. Now, based on this new guideline, Milwaukee County is currently in the medium level, meaning that among other recommendations, masking is not required in all settings. Now, when in this category, masking may be variable. In high-risk settings, such as healthcare environments or shelters or correctional facilities, or among those individuals who are in more vulnerable categories, masking remains critical. When gathered with a group of fully vaccinated people, it may not be as critical. Now, what comes in between those two is less well-defined, but caution is a wise approach. And that's why here in Milwaukee County, we'll continue to require masking in certain settings. In this time of medium levels in our community, yellow means caution, and we want everyone in Milwaukee County who relies on myriad essential services that the Milwaukee County provides to feel safe. We are seeing receding disease burden at this point in the pandemic. And we don't know how long it'll last, but it very likely we'll see more variants, and we may see more increased disease levels. But this consolidated guideline from the CDC provides a roadmap for moving forward together with a clear understanding of how to align policies and practices. Now, it's still important to remember that despite our promising trend, no child under 5 can yet get the protection from the vaccine. 7 million immunocompromised people in the United States may not get full protection from the vaccine. And those who have medical conditions or who are older remain at greater risk from infection. Now, for those people and others who may want to provide an added layer to protect themselves or protect their families, or protect those vulnerable populations, masking may very well remain an important step for them in many situations. The CDC guidelines in the yellow category inform higher risk individuals to talk to their healthcare provider about whether to wear a mask. Well, for about 25% of our population, there's no primary care provider to be called upon, let alone to provide an answer in a timely manner. So my recommendation would be, if you're high risk, or if you're concerned about your risk, just wear a mask and ensure that it's a high quality KN95 or N95 mask to get the most protection possible, especially in settings where not everyone around you will be masked. In the end, we want to move forward with a strategy that's data-driven, equity-focused, and expert-informed. This is an important step, but this has to go hand in hand with working to ensure that as many people as possible are vaccinated and boosted. We know that vaccines and boosters are the most critical layer of protection against COVID. Thank you very much. Stay safe, and I'll hand it to Commissioner Johnson. And congratulations, Commissioner, on 1 year of exemplary leadership and service to the city. Your tireless work is deeply appreciated. Thank you.
Thank you, Dr. Weston, and thank you, Mayor Johnson. As the mayor mentioned, the mask ordinance put in place by the Milwaukee Common Council in January expired today. While masks are no longer required within public spaces in the city of Milwaukee, they remain a strategy to reduce the spread of COVID-19. As we move forward, I want to stress the importance of approaching masking respectfully. There remain situations where we should wear a mask. If you have symptoms of COVID-19 or you aren't feeling well, if you are within 10 days of COVID-19 diagnosis and are around other people, or if you have been exposed to someone with COVID-19 and aren't quarantining, you should continue to wear a mask. Masks will still be required in some locations, some county sites, and including the Milwaukee Health Department clinical settings, on public transportation, and within many schools. Additionally, businesses can choose to require masks, and patrons of these businesses should respect COVID-19 rules put in place by business owners. None of us know the circumstances of the people we come in contact with every day. Some may be immunocompromised, some may care for a high-risk individual at home, and some may just not be comfortable being unmasked in public. Regardless, we must respect their personal masking choices. As Dr. Weston mentioned, the CDC released new COVID-19 community level guidance on Friday. This new guidance shifts the focus to preventing severe illness and death by measuring the burden and disruption to our healthcare system. The City of Milwaukee Health Department dashboard will be updated over the next week to incorporate the new CDC measurements. In addition to our current grading metrics, we will add hospital metrics for the Milwaukee region and ensure we have the most accurate data from the state. One thing to note, as our metrics change, we have to be cognizant that our hospital metrics are influenced by severe cases in the surrounding communities and suburbs. Surges in surrounding counties constrain our healthcare system in Milwaukee County, where all of our residents seek care. We will continue to utilize and share local indicators such as wastewater data and burden rate to better reflect the circumstances within the city. As a reminder, the pandemic is not over, but we have learned a tremendous amount over the past 2 years and are really putting what we have learned into practice. Thank you.
Thank you, Commissioner. All right, a few questions coming in the chat here. First question is from Eric Gunn with Wisconsin Examiner, both for Dr. Weston and Commissioner Johnson. Some in the disability community have expressed concerns that relaxing mask guidance ignores groups who may be more vulnerable to COVID-19 and its effects. What would you say to those groups?
I would say that one of the downsides to the CDC guidelines is its approach to equity. I talked a little bit about the equity approach with saying call your primary care provider. I'm not sure that that's an equity-focused approach to determine masking. I think another one is when you're in yellow, when you're in this middle ground, the way that it discusses and deals with vulnerable groups, including groups that you're talking about. So what I would say to those groups is to continue masking, to continue to be in safe settings. And when you wear a mask, to do KN95 or N95 masks. We know that masks like that are still quite effective, even when others around you are not masking. Now, they're not as effective as if everybody was masking, but they do make a difference. So as we move forward, I think that's one recommendation that folks who are vulnerable, but also people who want to protect those around them who are vulnerable can take.
Thank you, Dr. Weston. Our next question comes from Allison Durr with the Milwaukee Journal Sentinel for Commissioner Johnson. She says, could you see any situation in which a mask mandate would be reinstated in the city, or are we simply past such mandates at this point in the pandemic, both medically and in terms of what society will comply with?
Thank you. This is a great question. I think I'll answer the second question first in terms of what society will comply with. Again, I think we've learned a lot over the last 2 years and people are tired. That said, we can't predict what's going to happen next. We don't know where the next variant is or what it is, what impact will be on individuals, on people who are immunocompromised or more vulnerable, or our children. So I don't think I can say with any certainty what the future brings, but there is a measure of hopefulness at this point, but also a note of caution that we still have people who are vulnerable. We still have inequities and who's impacted most by COVID-19, and we still need to respect people's individual masking choices.
Thank you, Commissioner. I do see Allison has another question. We have a few other COVID specific questions, so I am going to make time for those. Time permitting, I can circle back to your second question, Allison. Our next question comes from Taj Mahal with CBS 58, and it for our health experts on the line. A new study this week found that Pfizer vaccine's protection against COVID wanes quickly in ages 5 to 11. With mask requirements dropping in schools, what's the concern moving forward for how to handle infection in these schools, especially with the risk of new variants?
Yeah, so I appreciate the questions. This was a study that came from data in New York City looking at kids 5 to 11, but then also teenage age groups of how effective the vaccine was as time went on. Now, I think it's important to caveat with these studies that it's not a published study yet. It's a preprint study, so it hasn't been reviewed. The data hasn't been looked for conflicts and things like that. So it's important to review the study. But looking at the data from it, it does appear that in 5 to 11-year-olds, after some time had passed, the vaccine was not as effective in preventing infection. What it did remain quite effective against is preventing severe disease and hospitalization. So to your question of what does this mean, I think it means that a layered approach continues to be important. We know that vaccines are the most important layer, but also one layer of protection. Other layers include masking. Other layers include distancing and ventilation. And so in kids where those 2 doses of vaccine are not as effective as we might hope in preventing infection, even though it prevents severe disease and hospitalization, those other layers remain critical.
Our next COVID question is from Eric Gunn with the Wisconsin Examiner. He says, wastewater surveillance data from the state is looking like it is going down in many communities. Does that have any forecasting or predictive value?
Go ahead, Dr. Weston.
All right, I'll start. I think the answer is yes, especially in the future. So right now, wastewater levels are low because disease burden is low. But when disease burden gets low, testing also goes down as well. And we have very low levels of testing right now. And that might be okay because there's not as much burden of disease in the community. But what that means when there's low levels of testing, it's a little harder to pick up when COVID starts ramping up again. But wastewater is somewhat, maybe this is the wrong choice of word, but wastewater is somewhat immune to that. Wastewater will rise even as people are not getting tested. And so I think it will remain a critical indicator moving forward to understand when we're starting to see those warning signals of increases in burden of disease.
And I would just add, we have really looked closely at wastewater data for the last year since I've been in my role to look at whether or not it's reflecting the infection rates that we're seeing in our testing, but also as we moved into Omicron, we used it to look at what the actual burden was in the community. So I do think it has some forecasting and predictive value, and we are certainly going to continue to use it.
We've got another question coming in from Sean Kirby with Wisconsin Health News. For Commissioner Johnson, he said he asked a similar question of the county executive last week. The question being, the Wisconsin Policy Forum and UW released 2 reports last month looking at public health in Milwaukee County. What is your reaction to the reports? Do you support or see the need for a greater role for the county in public health or consolidation among municipal departments?
Thank you for the question. I think the reports were really insightful. I actually learned quite a bit reading them about the circumstances of the various municipal departments. We all work very closely together and have really collaborated significantly throughout the course of the pandemic and our response. So I don't have a response in terms of, I don't really have a reaction other than I think that a further conversation and really looking at how closely we worked through COVID-19 and how successful that was needs to be highlighted.
Thank you, Commissioner. Jason Smith with WTMJ 620 AM radio is wondering for Dr. Weston or Commissioner Johnson, do you think we'll need yearly vaccines? Yearly COVID-19 vaccines, I'm assuming.
Yes, in short, I think we will. I think that this is not I think it's probably a 3-dose individual or initial vaccine that we're seeing. But I do think that there will need to be further vaccination down the line. And that's not terribly unusual. You look at measles, you look at tetanus, you look at hepatitis. These are multi-dose vaccines to raise your level of immunity and teach your immune system to protect yourself. And you look at things like flu or tetanus. These are vaccines that you need to continue to get at regular intervals throughout your life. So I think this will be similar. Of course, nobody knows the answer to that. But my guess would be yes. I think there will be some regularity in scheduling of COVID vaccines to maintain protection.
All right, seeing we don't have any other COVID-specific questions, I'll circle back to Allison Durr's question with the Milwaukee Journal Sentinel for Mayor Johnson. She says, regarding the legislation approved by the Common Council this morning that would end the fight over the $100,000 contribution in the Couture apartment contract, do you plan to sign the legislation, veto it, or allow passage without your signature?
I have not received the files yet in my office. I'm expecting those shortly. I will review the file and make a decision at that point.
Thank you, Mayor. And we'll give it just one final minute to see if we have any additional questions. All right, seeing that there are none, that will conclude our briefing for today. Thank you all for joining us, and we will see you next week.
Thanks, everyone.
Thank you.